Do you have any sexual health concerns? I'm not just talking about sex. We are all human beings. We interact differently with everyone. We develop relationships. Love and families are a part of this story. My clinical nurse leader, Fifi, knew my passion for taking care of our veterans with spinal cord injury to have a healthy sexuality. She said, come on, let's go talk about your sex stuff. And she took me to a conference room where I met Amanda, an innovation specialist, who told me to draw my idea. This is what my idea looked like. I envisioned a veteran with spinal cord injury laying in bed with lots of questions on his mind. One of them being, am I ever going to be able to have sex again? But instead of nobody addressing this, we have providers that will ask our veterans, do you have any sexual health concerns? And they can be referred for basic sexual health education and treatments. They go home knowing that they can have that intimacy that they so desire. They go home and they want a baby. Well, we can collaborate with urology, utilize our resources, and they can have a family of their choosing. So I ask again, do you have any sexual health concerns? I'm sure some of your veterans do. My name's April Conway. I'm a nurse practitioner at the St. Louis VA Spinal Cord Injury and Disease Center, one of the 25 centers across the country. There are 42,000 veterans with spinal cord injury across this country, and I would like to share the stories of some of those veterans that I serve. Andrew was 19 when he was injured. He became a paraplegia, losing the lower half of his body functions. And the questions he was asking me, am I going to be able to keep my girlfriend? Am I going to get married? And am I going to be able to have children? My mother wants grandbabies. And Roger and Rachel were happily married when he fell out of that tree stand, suffering a spinal cord injury. He had many thoughts, I'm sure, but one was, are they going to be able to create a family that included children? And then Charles and his lovely wife, he fell and sustained a cervical spine injury. Intimacy was an important part of their relationship, and they wanted to maintain that. So what did we do for Roger with all of those questions? We asked him if he had sexual health concerns, and he said yes, just as 61% of our spinal cord injured veterans have. He was referred to me, where I provide that basic sexual health education and treatments if they so desire. I can also discuss options for fertility. I call this an interdisciplinary approach. So let's see what our social workers, Kim and Kate, can do to help with Roger's sexual health needs. They seek to help whole family systems adjust to spinal cord injury, and this includes sexual health. They want to help separate the caregiver role from the intimate partner role so that intimacy is not lost. And how about our physical and occupational therapists, Jody and Kim? They do what they love. They are often the first to identify sexual health needs with those veterans because of the close clinical relationships they build during that rehab process. Therapies can assist with positioning, adaptive devices, and all of these other things. So teamwork makes the dream work. We were able to help Roger know that he can experience all of these things and that his physical limitations do not negate the fundamental aspect of being a human. That's a picture of him with his beautiful children. And so instead of keeping this to ourselves, we want to help all veterans with spinal cord injury and disease. We have so far helped 841 veterans in our area, and we are seeing patients in 33 different clinics. 11 different disciplines are asking if our veterans have sexual health concerns. Talk about access to care. We're doing this as a community, and we're working together, and adapting this across the nation. So let's take a look at some of our other sites. In St. Louis, we're not only asking our veterans if they have sexual health concerns and educating them, but we are able to send them home knowing that they have a comfortable sexual health, they can have that intimacy, and they learn all of this during their acute rehab process. We've also spread to our spoke sites. So in Columbia, Missouri, at one of our sites, a social worker, Cynthia, is asking veterans if they have sexual health needs. I am so looking forward to working with the team that she is trying to build and educate that staff on talking to their veterans about sexual health. This will create that continuity of care and maintain that conversation in their local clinics. And I was very fortunate to be a part of the Diffusion Academy, and I met people like Jasmine, a MEO coordinator in East Orange, New Jersey, at one of our other SCI centers. We are collaborating with other MEO coordinators to try to standardize sexual health assessment and education for our veterans and for our staff. And so I would highly encourage you to join this endeavor and talk to your veterans about sexual health. This can be adapted to different patient populations. Educating on this topic creates a comfort level so that we can talk about sexual health. Please visit the VA Diffusion Marketplace, which is going public, to see this practice and the resources I have for you there. Also, feel free to contact me with any questions. And with my story, I hope you can find it in your heart to ask your veterans, do you have any sexual health concerns? Thank you.